Let's talk about tomatoes. Who grows tomatoes in America? Anybody expert on tomatoes? After this discussion by Senator Sanders, you're wondering why we need a wall at all. The state of health care described by Senator Sanders, it certainly can be made better and needs to be reformed, absolutely. Can we spend less and get better outcomes? Absolutely. But to believe what was being said, why are so many people coming to America? Why aren't we leaving to go to someplace else where you don't die in the streets? So the facts you're describing and the activity of the American people really don't match up. If it were, as you said, one of the most disgusting examples of healthcare being provided on the planet, people would be leaving America, not coming to America. Who grows tomatoes in America? Anybody expert on tomatoes? The government doesn't grow tomatoes. Tomatoes are grown by the private sector, and there's competition in the marketplace to grow tomatoes. And we don't do collective farming. And the last thing you want in the tomato world is to have the government take over the production of tomatoes and go to the Soviet-style collective farming where everybody eventually starves. So let's keep tomatoes the way they are and let's improve healthcare.
Today, Americans with COVID-19, just like Americans with cancer, with any illness or injury, can face bankruptcy because of medical bills. 1 in 5 U.S. households are carrying medical debt, which now exceeds all other forms of debt sent to collection agencies in this, the richest nation in the world. Medical debt should not exist, and in many other countries it basically doesn't. It is the consequence of the irrational way our country finances medical care. Seniors with lung disease who have rationed their expensive inhalers because of high copays, patients who've rationed their insulin and ended up with severe complications of diabetes. Typically, it is only after becoming severely ill that patients realize that their insurance is riddled with holes. Even if you have coverage, unless you're Elon Musk, you could be one illness or injury away from financial ruin.
I think we should vote on whether or not Medicare should negotiate prescription drug prices so that we can lower the cost of prescription drugs in this country in half, and a lot of other issues. So you're talking to the wrong guy here. I like the idea of votes.
Well, with all due respect, Mr. Chairman, you're the chairman of the committee. This is about Medicare for All. If you want to vote on all those things, fine. Let's start with your idea.
Let's vote on all of them.
Well, let's start with Medicare for All. Have a vote next week.
All right.